Hey everybody, welcome to week 3 of HSERV 162, and today we're going to discuss an overview of chapter 3 of our textbook on the topic of pharmacodynamics. And as you recall from weeks 1 and 2, we're starting to build a common framework of understanding for a drug's mechanism of action. In other words, how it works. And so this week rounds out those first 3 weeks with the topic of pharmacokinetics. And just a note, in addition to reading chapter 3 of the textbook, be sure to also read the additional materials I've handpicked and posted in the week 3 module, as well as the learning videos. These really help internalize the subject matter. And also just another reminder on the skills of studying. Caution you against just reading through each chapter really fast and then you get what you get or you don't get anything, but rather read through and study the sections of the textbook, the chapters, and then put it away for a while, reapproach it and read through it again using your highlighter. Highlight the most important point you think on each page and put the book away again. Come back, and if you're as obsessive as I was as a student, I would outline the chapter for studying, but you don't have to do that. And then be sure you look at the study questions at the end of the chapter and see if you can come up with the right answer by going through the book. Okay, so today in chapter 3 on pharmacodynamics, that is, how drugs exert their effects. And as you recall from weeks 1 and 2, after administration of the drug into the body, either enterally, parenterally, or locally, the drug's got to ultimately absorb into the bloodstream for distribution to target sites and then affect receptor sites before it's metabolized and excreted. And according to our textbook, there are 3 types of cell membrane spanning proteins that most drugs will interact with. And the first type is a receptor. These receptors are types of cell membrane spanning molecules that interact with endogenous neurotransmitters. Now, endogenous means from within. Exogenous means from without. So for an example, endorphins or serotonin or dopamine are examples of endogenous neurotransmitters. They're from within. They're made by your body and they're used by your body. As an example, morphine or methamphetamine, for an example, or antidepressants or antipsychotics, they're exogenous substances that can change the and affect the receptor sites. So the second ones are of these cell membrane spanning proteins are called transporter proteins, and they move neurotransmitters across cell membranes. And lastly, the third one are enzymes, and they're the final type, and they regulate the synaptic availability of neurotransmitters. To create an effect, drugs and or neurotransmitters have to bind to particular receptor sites due to their high specificity. So binding is really important for drugs to do what they do. An action that can affect the response to a drug is the binding properties of that drug. There are a couple of concepts about binding properties. One is what they call full agonists, and this is kind of also a way to categorize all the different drugs, legal and illegal. An agonist drug is something that facilitates a response. It mimics the action, or can mimic the action, of a neurotransmitter, agonist drug, whereas a partial agonist, in contrast, doesn't produce the maximal effect of a receptor system despite the dosage of a drug. For an example, Suboxone. And lastly, there's a group of drugs whose mechanism of action are an antagonist drug, and they block the effect of an endogenous neurotransmitters, i.e. naloxone or Narcan or antipsychotics. And then inverse agonists produce the opposite effect of an agonist when bound to the receptor site. Chronic administration of drugs is a fairly common occurrence. With a long-term stimulation, neurons can downregulate or desensitize receptor sites, reducing the effect of the constant stimulation. And downregulation, where receptor sites are desensitized, is actually a form of tolerance. We call that cellular tolerance. Fewer receptor sites, not as much binding can occur. And then by contrast, when cells are constantly blocked by an antagonist drug, remember antagonists don't allow neurotransmitters or drugs to bind at receptor sites very well, the cell will upregulate and sensitize the receptor sites to counter the antagonistic effect. And this shows you that resilient flexibility that brain and body has to changed chemistry due to drug-induced changes. Interactions between drugs and receptors can be described in a dose-response curve. And the textbook gives a great outline of a dose-response curve. Potency, not purity. Potency describes the least amount of a drug needed to produce an effect. Potency is completely different, and some people will confuse potency and purity levels and use them interchangeable, which is wrong. Potency is the least amount of drug needed to produce an effect. Purity is the quality of the substance. So our learning objectives this week are fivefold. One is to define the basic concept of pharmacodynamics. And two, to be able to summarize acute and long-term receptor effects due to drug exposure. And that's referring to downregulation or upregulation. And three, describe and differentiate between the binding effects of partial agonists, agonists, and antagonists. Fourthly, explain the therapeutic index. The book talks about this thing called the variability of individuals' responses to drugs with LD and ED50s. But explain the therapeutic index of a drug and the types of drug interactions that can occur. And finally, describe the different factors involved in polypharmacy when multiple substances are used at the same time and the dangers, some of the dangers involved with that. Okay, that's an overview of this week on pharmacodynamics, and see you next time.